Thank you so much for joining us here at Abu Dhabi Healthcare Week. This is the inaugural event, and I think it's significant that a place that has been an incubator for so many revolutionary ideas is willing and ready to host a summit like this one, talking about making that transition from healthcare to health. In your mind, what is Microsoft's role going to be?
Well, one of the things that we realized is that Microsoft has a huge opportunity to be a partner in this journey. There's so many issues that we see in healthcare today, problems that are very difficult to solve, but technology can help us solve them. And you need cloud infrastructure, you need infrastructure that allows us to have security around the data. That's one of the first things that Microsoft can provide. You need to have an opportunity to apply artificial intelligence and other capabilities, which requires storage and compute, large computations. Microsoft can provide that. And one of the things that we also have recognized is that the AI has gotten a lot better. And there's things that we can do today that we could never have done before. And so with all these things together, we have an opportunity to work with our partners to be able to solve the problems together.
What kinds of things are you involved with today in the UAE?
Well, we made a big announcement with a partnership with M42. Really excited about the opportunity to be able to work with an organization that's deeply committed to finding ways that data-driven decisions can be used to enable better health for their patients, the members, the people that are in the country. And what we find is that is something that we're particularly interested in. How do we use the large amounts of data that currently exist in a way that will allow us to be able to predict or identify those individuals that are higher risk so we can intervene earlier and potentially lead to more proactive care?
Yeah, but one of the conversations that we've been having on the sidelines of this forum has been not just about how AI and technology are going to revolutionize health going forward, but also how it can change the game for those in the global south, for minorities, particularly for women. In your mind, where can Microsoft play a role in that?
Yeah, so it's a great point because one of the things we see is individuals who see the clinician regularly will get better care. Now, if you don't see the clinician regularly because maybe you live far away, maybe you don't have access to the clinician resources, there's a lot of reasons that people don't see the clinicians regularly. These are individuals that are oftentimes in the underserved, vulnerable populations, and those are the individuals that may benefit the most from some of the AI technologies. So I'll give you an example. Let's imagine that you went in to get your eyes checked. And as you went and you got your eyes checked, there's a DICOM image that's taken of that image. And now imagine AI is applied on top of it. We can diagnose diabetes, cardiovascular disease, chronic kidney disease, a whole series of medical conditions that normally would have required a clinical visit, blood tests, a whole series of tests, could all have been done just by simply getting a 2-minute scan of your eyes, non-invasive, and that's possible today. There's so many ways that we can start looking at the information that's currently gathered, apply AI on top of it, identify individuals that are at high risk, and pull them back into the system. And those are the opportunities for us to be able to think about who's going to benefit the most. It's the underserved, underrepresented communities.
In your mind, with, frankly, the UAE's access to the global south, for example, how important do you see this place as a conduit?
Oh, extremely important. And what we're doing here is we are incubating these newer technologies to show exactly how it could be used. And with that capability to be able to push that into arenas that don't have these technologies, we need to have technologies that are cost efficient, easily accessible, easy to use, and allow us to be able to address the problems in an immediate manner. That's exactly what we're trying to figure out. And that's why I feel like the things that we're doing here are not just going to benefit the folks in the UAE, but also the entire world.
And frankly, the UAE understands the value of PPP, of public-private partnerships. But how do you take what you're working on here and apply it globally?
Well, one of the things I think we're starting to realize is that no one organization can solve this themselves. It does require a level of collaboration and partnership that we've not seen before. And in fact, if you reflect on the pandemic, how did we solve the issue of getting vaccinations into communities all around the world, whether they're in certain low, middle income countries, communities within certain countries? We relied on individuals within the communities, community-based organizations, public health, a variety of different organizations. And what that means is we have to rethink how we deliver healthcare. It can't just be about an existing hospital and a clinic. It's got to be about how do you empower individuals to be able to perform above and beyond their license. AI allows us to be able to do that. It gives people the ability to be able to do things that they could never have done before. And with the digital interconnectivity, we can share information in a seamless, privacy-preserving manner that allows for some of that data to be managed in ways that patients will benefit. And that's what's extraordinary, because for the first time ever, we've got technologies that will allow us to be able to do this.
In your mind, what's the greatest challenge here? Because, unlike in the UAE, that is very, very business friendly and frankly is looking for those PPPs, it's a bit more difficult in the Western world. To your mind, what's the greatest challenge?
Well, I wouldn't say greatest. There are many challenges along the way. I think the first is that people don't even realize the tremendous opportunity that AI can have. When we think about what's in front of us, how is healthcare being delivered? It's being delivered by healthcare systems, hospitals and individuals that today are not able to manage the incoming demand. The more patients coming in, the more complex, the greater amount of clinician burden, the things that are being placed on clinicians, less clinicians, and then on top of it, cutting reimbursements. You put all that together, it's a system that will crash. And so what we have to do is we have to recognize that we have to change the model of care. And it can only be done if we empower people with technology. So then if we agree on that step, which I think is actually the very first thing we have to start recognizing, the urgent need to change, apply the technologies, then we have to start embracing the technologies in a way that's privacy preserving, trusting, and responsible. And so the whole movement towards responsible, trustworthy AI allows us down the path of being able to have confidence and trust that what we're delivering is something that people can rely on, that they can feel comfortable with. And that will allow us to be able to then move forward to the next stages. I think there are a lot of things that we have to do. Sometimes we find that technology itself isn't the answer, but it allows us to be able to think of what's possible. A lot of it's around change management, and it's around implementation and making sure that people feel comfortable.
Really appreciate you joining us here at Abu Dhabi Global Health Week. Thanks so much.
My pleasure.